Good afternoon, everybody. Welcome to the second monthly session of Senior Voices. It is a forum to help to listen to you and to empower you. And I'm not good at this, so if I make a mistake, please don't kill the messenger. Okay, so honored guests, seniors, welcome to, as I said, the second monthly session, excuse me, of Senior Voices. Today we are going to be talking about Medicare. We will have a sounding board for your problems, gripes, groans, cheers. We will have a conclusion, and at the end of the session, we will be networking, all of us together. Okay. So Senior Voices is, like I said, a monthly forum. It will be providing news of relevance to seniors. It is delivering education of unique interest to seniors and serving as a sounding board where you will be heard, and we will try to be like a middleman. We will put the problems together. The most important problems we will be taking over to the selectmen and discussing them and trying to solve them. So are there any questions so far? Okay. The mission is to study the needs of the elders. The members, if you are here, would you please stand? Peter Bancel. This is the members on the Commission on Aging.
Three of us.
Okay.
Well, four of us.
Okay, well, I'm going to say the names, but if you would stand when I say them. Peter Bancel, Andrea Beebe, Maureen Culhane, Carmen Martin, George Noyes, myself, Clem Salivi, and the chair of Commission on Aging, Joe Turnillo. So we are the people who will, we hope, be interacting with you and be able to solve some of the problems that you have in Ridgefield. We have updated, and Andrea Beebe did this, the senior directory, and she created a card with all important dates and areas that you can call in Ridgefield that are important with phone numbers. This can go on your refrigerator or it can go in a rack in your house. Am I speaking clearly? Yeah. Too fast, too slow? Okay, good, okay. We also collaborated with the Playhouse to provide free movies for seniors. And we had a grant where if a senior came, they would get free popcorn and a free drink before the free movie. And these movies were really wonderful. I went to a lot of them. I'm going to leave this in the back. This is a new program for the Playhouse of free movies for seniors. So when you're stuck in the house and it's raining out, you can call the day before to not Rides for Ridgefield, but Heart, and they will bring you from your home to the movie and back again. So I'll leave that in the back. We did have success in trying to get some seniors out of their homes because of the pandemic. They did not want to leave to do anything. And we were able to get some people to come to the free movies, especially when they knew they were getting popcorn and they were getting a drink. So it was successful, and I hope that this session will also be the same. We do not have a grant this time, but it's very, very nice. And the director, Robin Ronai, comes down and introduces herself to everyone and makes everyone feel comfortable. So if you want to go see a movie, they're free. Also, what the commission did was arrange for Deborah Anns to have an ice cream day for seniors and call it National Ice Cream Day. And Carmen Martin, who's in the audience, was responsible for doing that. And also, we are working with town halls and local nonprofit agencies on grants and fundraising. And there is we are assembling a blue ribbon panel of advisors to accelerate the Commission on Aging's mission. We are also conducting a town-wide senior citizen needs assessment survey, which is a very, very important thing for everybody, because the town does not want to lose seniors. They don't want you to move away. If you have problems, they would like to address the problems and keep you here. We had a really good session the last time we met, which was in September 10th, I think we met. And
Ma'am,
yes,
what was the date of the survey that's coming to the house?
the survey is coming to the house by the end of the month.
December 15th?
No,
By the end of what?
by the end of this month, by the end of October. Mr. Ken Devine or Divine, I'm sorry if I'm mispronouncing the name, Mr. Devine has a company that's global that does really good studies. And he and members of the commission and town hall got together and created this survey for the seniors. It's extremely extensive, and it's like divided into what your needs are and what they were at certain ages. So what were your needs when you were 60? What were your needs when you were 70? What were your needs when you were 80? Did you have health problems? What has become better? What has become worse? How can you get help if you need it? And there were a lot of good inputs from people to whom we were addressing about their needs. And one of the needs was wellness. And we arranged to have someone from RVNA come to the next meeting and address wellness problems for anyone.
I think it's that computers, it's obstructing you.
Oh, I'm sorry.
Or the hearing.
I can't do anything about that, but anyway, do you have any questions so far? Yes.
How is the survey going to be disseminated?
Okay. The question is, how will the survey be disseminated? This is going to be sent out to every senior citizen. If you cannot fill it out, you can call and have someone come and help you, or someone will come with a computer and do it for you. This is done, this survey was created by, as I said, Ken Devine. He has a global company, and he also donated his time and the survey to the town. Other organizations, philanthropic organizations, have also donated money for printing and for sending out the surveys. So if you send it back, it will really be a good way for us to try to get to the selectmen to solve the problems and keep everybody in Ridgefield, because that's where we want you to be. It's such a great place. Anyone else?
Was there a date that it should go back?
I'm sorry?
Should it go, by what date should it go back?
Joe, do you know what date it should go back?
Is it, you want it filled out right away, don't you?
Well, of course you do, but I don't know if there's a date, a specific date to send it back. The survey.
Can you all hear me? Okay, so there are some people who are participating via video conferencing, and that's why I'm speaking into the mic. So a couple of things relating to the survey. First, it is going to be, the intent is for people to receive it via email if possible, so that you can directly input your response. You will be hearing over the next few weeks via the library, the Commission on Aging, Town Hall, RVNA, Founders Hall, etc., about ways to get the survey. So if you don't have email or are not adept at the computer, then, as Clem said, there will be hard copies available in multiple locations. Additionally, there is a cadre of people within, hold on just 1 minute, within Ridgefield who will come to your house with a tablet if you want, because we want to hear from you. So let me see if I can answer your question now. Go ahead.
Will they be in the library?
They will. Yes, they will. Yes, they will. And if you want to give, my wife is sitting next to you. If you want to give her your email address, if you have it, then that way you and I can connect directly to address any questions we might not address now. Was there any other questions on that? Yes, ma'am.
Oh, that was, the ice cream date has passed. It was, Carmen, when was that date?
I believe the third Sunday in July, and national holiday. Can we have one? Well, that was, okay, that was, okay.
So unfortunately, on that day, we had a major rainstorm. So I don't know how many people had free ice cream on that day. Okay, anyone else? Question? Okay, so now getting to the library. I don't know if you know that the library is open 7 days a week, and it is a community destination. The resources are, it provides diverse programming.
For summer.
I'm sorry?
In the summer.
Well, right,
Sundays.
It was.
Well-
It's closed in the summer on Sundays.
okay, I'm sorry. It's closed in the summer on Sundays, but otherwise it is open 7 days a week. We are here because of the library. They've provided all of these wonderful benefits for us to get in touch with you and have meetings with more than 3 or 4 people. It has technology support, which you are looking at right now, homebound delivery. The staff is extremely knowledgeable because I know nothing about technology, and it's a welcoming space for people. If you come and you go upstairs and you sit, you read, you feel good about yourself after a while. It's really a lovely place to be. And it anticipates and meets the evolving needs of Ridgefield and its residents. Lots of programs here. If you don't have the newsletter, please sign up for it, because there are many, many things that you can come to. One thing that I came to was how to use the computer, which I still don't know how to use. Anyway, that was one thing that I came around. But if you look around, there are a lot of things here that you can make useful for yourself. And I'm sure you already know that. Any questions? Okay. Okay, now the survey. We will soon be administering this survey to understand your needs. As I said, it was professionally developed together with Ken Devine and members of the town hall and various philanthropic associations. Ridgefield's leading nonprofit people were really involved in this and are responsible for printing and mailing all of these surveys, which is really very nice. I think it's a wonderful thing to be able to live in Ridgefield. I am so blessed. I've moved here 2.5 years ago, and I'm so blessed that we have so many things for seniors that I have never seen before. It's really wonderful. So that's why we want to keep everybody here. So fill out the survey, please. Okay. Okay, so we heard you last month about developing monthly educational programs that will address your needs on every topic. And one of the results of that is that we are having someone from RVNA come to our next meeting and speak to everybody about wellness and health. I know that a lot of people were concerned about care at home.
The meetings.
Right here.
Always.
They are
once a
always,
month,
yes.
they're all.
The meetings are always in the library.
Date, Ethan,
The next one will be on November 14th.
13.
14th.
14.
November 14th will be the next meeting in the library.
And
And the
that's when it's usually on the 14th of the month.
You know, it will depend on the Tuesday of the month, what date that is.
I don't know what you mean. Is it
Another-
Tuesday or Thursday? Changes every time.
It changes every month, like it's,
So you
last-
have time to know when it's gonna happen.
no, you have to, well, if you read the newsletter or you read the Ridgefield alerts, you'll find out, but it's usually the Tuesday of the month,
Okay,
okay?
okay, thank you.
And the next one will be November 14th. Any other questions? Okay. Also, news. There are now 2 Commission on Aging slots available for anyone who would like to come and join. It's volunteer. You're giving back to the community. And we have a blue ribbon panel that we're trying to accelerate. If you're civic minded, committed to service, and able to offer advice, introductions, or other skills, please come and talk to us. Okay. Anyone with a question? I thought everybody would volunteer.
I thought, I just wanted to make sure that everybody knows about the 068 magazine. I get it at my house and it comes every 2 months.
Yes,
So not over, not in July and August, but in June and July, May and June, and in November and October and November, September and October, it was published. And it also has a great deal of the information that you just gave about what's available here in Ridgefield. And there's a tremendous amount of things available for whoever wants to go. And there's a very big, nice article about transportation, which seems to be a major problem for most seniors.
well, that was a discussion the last time that we had a meeting, was transportation.
And it also includes on the magazine, the Ridgefield and Wilton, their transportation, both places. And it talks about the rides for Ridgefield and it talks about other transportation. There's a lot of information in that magazine. It talks about A1. There's many, many articles in there. It would be nice that people were able to get it because they would enjoy it. It's free and it comes to your house.
Yes,
And, you know, I know we're seniors, but we like to go places like the Playhouse. It has information about those
free
things
movie.
that were free at the Playhouse. I mean, there's tons of information in this magazine
Mhm.
that people would enjoy. And it doesn't necessarily mean that they're seniors.
Yes, well, thank you
There are
very
people
much.
that live here.
Thank you for the information. I'm sure that everybody will benefit from that. Thank you. Okay, and now there's a question from someone.
Okay.
I think that's a question.
No.
No, that's not a question. Okay. Are there any other questions before I introduce our speaker for today, who is the chair of the Commission on Aging? He will be talking about Medicare, and his name is Mr. Joe Ternullo. I'm sure you know him. Thank you. Okay.
Okay.
I have hearing aids, so I don't always hear it. That's why I needed more.
Hi, everyone. I hope you can hear me clearly. We have 2 speakers. I'm one of them. And this is a very important topic. Medicare. I'm going to talk about 2 of the 3 topics we're discussing on Medicare. First is an overview of Medicare. I'm going to go through the slides relatively quickly. with the thought that you can ask questions. There may be some slides that I perseverate on a little bit because I think there's something that's particularly relevant in the slide. So this is the Medicare and 8 slides, Cliff Notes version, what you need to know. Okay, so what is Medicare? It's a government health insurance program for people age 65 and older and those who are disabled. Don't confuse Medicare with Medicaid. Medicaid is means-tested and needs-based program, which is administered by the state. Slide 2, Medicare, the basics. The original Medicare is Part A, which I would call hospitalization. Part B, doctors and tests. Sometime later, the government brought in private contractors, private insurance companies to provide an option like HMOs, and that's Medicare Part C. And Medicare Part D is a prescription drug program. The C and D were not part of the original Medicare. They came after. Medicare covers 80% of reasonable and necessary costs, and you're responsible for 20%. And so people often purchase a Medicare supplement plan if they're on original Medicare to cover that 20%. Okay. How do you get Medicare coverage? It's easy. You sign up for it. In fact, I just signed up for mine earlier this month. I turned 65 in January, and so this is my initial enrollment period, which we're going to talk about in a few slides. So you can sign up for original Medicare, which is Part A and Part D, hospitalization and doctors and testing and so forth. Or as an alternative to that, you can sign up for a Medicare Advantage plan where you get some extra benefits. And we're going to have a slide on that too. And remember, since Medicare covers 80% of the cost, if you're on original Medicare, most people sign up for a Medicare supplement plan, which is also known as a Medigap plan. So Medicare Advantage, again, this is through private insurance companies that are approved by the Centers for Medicare and Medicaid Services, and they combine the benefits of Part A and B, and usually, although not always, usually Part D as well. And what I've listed here is the pros and the cons. So I'm going to spend a minute or two talking about these because I think it's particularly relevant to you. So what are the pros of Medicare? So first of all, can I ask, is those who are on Medicare, raise your hand. So some people are not on Medicare. But so if you're on Medicare, how many are on original Medicare? How many are on a Medicare Advantage plan? Okay, so this is relevant because in a few slides, we're going to talk about open enrollment, where, well, you'll see when we get there. But what are the pros of a Medicare Advantage plan? It's a simple all-in-one coverage, and I have a typo there. It should say for parts A, B, and generally D. It provides extra benefits, some dental, some vision, hearing, wellness. There's cost predictability generally because there are out-of-pocket maximums. So remember, if you're on original Medicare covers 80%, you're responsible for the other 20%. That's unlimited. But a Medicare Advantage plan has a cap. That cap might be very substantial, might be $7,000 or $8,000 a year, but you know you're not going to spend more than that. It provides a network of providers. Now, the advantage of a network of providers is that helps ensure that you receive coordinated care because it's a team of healthcare providers that work together. So it's not as if you're getting your primary care is here in Ridgefield, but you go to the Dana-Farber in Boston for cancer issues, and then you go to Yale for surgery. That's not coordinated. That's 3 different healthcare systems. This is one. And there's potential cost savings in terms of premiums, which you won't see here today because I didn't bring those as examples, but you might see as you go through open enrollment. What are the cons, though? So for every pro, there is a con, and it's important to understand the cons as well. There are network restrictions that limit your choices of doctors. So maybe you do want to go to the Dana-Farber, but you can't because they're not in your network. So the reason I mentioned the Dana-Farber is my wife and I, like Clem, are transplants. We've been here for just over 2 years, and we're from Boston. So that's an important thing to think about as you're making your decision on who you want as your provider, or who you might want as your provider. If you're fine now, you've got to think about, what if I get sick? Hopefully you won't, but what if I get sick? Who do I want to go to? And that's relevant in the Medicare Advantage or Original Medicare decision tree that you will create for yourself. Okay? Medicare Advantage generally has prior authorizations for certain services, and that leads to can lead to delayed care. If you're in Original Medicare, you don't have that problem. You don't have prior authorization, so you have to think about that too. Again, I mentioned geographic limitations. Let's say that you are fortunate enough to winter in Florida. So if you winter in Florida and you get sick and you're on a Medicare Advantage plan, will that be covered? And if it is covered, is it covered at a higher cost for you because it's out of network? That would not be the case with Original Medicare. The plans change yearly, so it behooves you to. This is not a set and forget concept. You really want to review options every year, and the additional costs, co-payments, co-insurance, etc., they can add up. Again, I thought it was relevant to spend time on this slide, and that's why I did. Medicare Part D prescription drug coverage. It is not required, but it's highly recommended. If you do not sign up when you're first eligible, there is a penalty that accrues each and every month. And the reason is Medicare doesn't want people to not sign up when they're well, and then when they're sick and they need $20,000 a year insurance, to just sign up. What they're looking to do is create a balanced risk pool so that those who are well and maybe are paying a $10 or $12 a month premium, that goes toward covering the costs of those who are sicker and need to purchase prescription drugs. So if you wait and say, you know what, I am not going to sign up for a Medicare plan until a prescription drug plan, until I absolutely need it, you're going to pay a premium. So some of you might decide, that's okay. I'm okay paying a premium, a penalty. That's okay. But you should know what it is. Know what your worst case scenarios are. Again, all of this is a plug toward participating in open enrollment, which we're about to talk about. So there are several different enrollment periods. There's the initial enrollment period. We're going to talk about open enrollment. There are special enrollment. There's general enrollment. I'm not going to talk about general and special enrollments now, but I will tell you that I am more than happy to talk to you about those. You can reach me anytime. Karen Gaudian, who is the Municipal Agent on Aging, is also more than happy to talk to you. And we have wonderful, wonderful colleagues from Western Connecticut area on aging agency. one of whom is here today. They provided all the specialized training I needed to speak to you intelligently on Medicare. I'm certified by them, and they're happy to talk to you about those too. But what we're talking about today are two open enrollment, going to cover that in another 2 slides or 3 slides, and initial enrollment period. Your initial enrollment period, your enrollment, you're entitled to enroll when you turn 65, and you can enroll 3 months before and 3 months after that. That's all the initial enrollment period, a 7-month period. As I said, I turned 65 in January, so I think it was on October 2nd, I enrolled. Okay. Medicare supplement plan, Medigap plan. These are overseen and regulated by the state. And we have a case study. It's going to be brief, but I put in the back handouts. If you didn't get the handout, there are other handouts as well. Make sure you get it on the way out. So these cover the 20% that Medicare doesn't cover. The cost of these programs vary. They may have some deductibles, some co-pay, some co-insurance, et cetera, or they may not, depending on which one you choose. In Connecticut, you cannot be denied issuance of one of those plans. So it's what's called guaranteed issue. And good news, you can change those plans anytime you want. On a month-to-month basis, you can change them if you want. That's another tremendous benefit that you get in this state. Okay. And for those of you who need assistance in covering the cost of Medicare, there are extra help. We list what the monthly dollar amounts are here. I'm not going to go through it in any detail now, but if you think it might be relevant to you, or you're not even sure, you just want to check on it, I'm happy to send you the slides. I think that these were all sent to you last night. And if you didn't get them because you're walking and you didn't sign up, you didn't register, we can send them to you. You can let me know. I'll send them. We'll send them to you, or you can call us, and we can go through this, and you can decide whether it's relevant for you or not. Okay. I have to tell you, this is my favorite slide of this entire deck. Okay. So I tried to inject some humor in this. So I called it the, now we're talking about Medicare open enrollment, the Santa Claus of healthcare time of year. And you can see my hashtags at the bottom. It comes only once a year. Get yourself some open enrollment time. So instead of presents, you unwrap potential cost savings opportunities. And because I liked Star Trek as a kid, you explore bold new plans like a healthcare adventurer, and you enjoy the peace of mind that your good health deserves. So what is Medicare open enrollment? So Medicare open enrollment is this period of time that actually starts in a few days where you can review all the options that you have currently, and you can change them. You don't have to change anything, and if you don't change anything, it's just going to go as it did the year before. But if you're on a Medicare Advantage plan and you want to switch to another Medicare Advantage plan, you can do it during open enrollment. If you're on a Medicare Advantage plan and you want to switch to original Medicare, you can do it during open enrollment. If you're on a Medicare Part D plan and you want to switch to another one, you can do it during open enrollment. And by the way, the switches, the analysis is not so much random and shoot from the hip, but it's, I believe, very formulaic. That's why I say it behooves you to take advantage of open enrollment. You can go right to the Medicare website, create a My Medicare account if you don't already have one. You put in your prescriptions, for example, and it tells you, it compares, as a compare function. This is the plan that you're on. But if these are the prescriptions that you're projecting for the next year, these are the plans that would save you money. Or, good news, you're on the best plan for your situation. So when is it? Starts October 15th and it runs through December 7th. So it starts next week. Who benefits? You. You benefit. And I can promise you that you are going to have at least one of the two benefits that are listed here. You're going to have peace of mind for sure that you've optimized your selections. Still going to cost you some money, but you're going to know that you are not squandering your financial resources. And that's the second point. If you make a switch, you're going to find that your wallets are fatter and maybe much fatter. So last year I was involved with this, and by my calculations, on average, each individual who came saved $750. I think that's pretty good savings. You've got the insurance anyway. Wouldn't it be nice to optimize it so that you have more money in your pocket at the end of the day? In fact, I happen to think myself that it is criminal that our state and federal elected officials make us go through this. I think it should automatically default, because especially when you're sick, it's hard. It's the hardest time to be able to think clearly and make financial decisions like this. Anyway, that's my thought. And this is what I wanted to go through. And I might have a pointer here. I'm sorry to look the other way here. If you don't have these slides, if you don't have the handout, they're in the back. What I copied here might be different. This might be a different version, like maybe an earlier version than the latest ones that are in the back. Is there anybody who doesn't have these? Raise your hand. Lisa, would you mind handing them out to people? I want to just keep your hand raised until you get them. My wife and Carmen are going to help you. There's a lady, two ladies here. Hi, friend. Okay. There's a gentleman in the front row. 3.
5-4. So is that the latest one?
Audrey is in the back. She can tell us if 5-4 is the latest one.
20.
It's the latest one that I found. It's the latest one that I found. Yeah. Okay, everyone have one? Okay, I'm going to give you the most extreme example. Oh, I'm not.
Yeah, see it. It's fine.
Okay, so what this shows is the different Medicare supplement plans going across the top. You can see A, B, D, C. Do you all see that going across the top?
Yeah.
Okay. Now, going down the page are the different carriers. And so what this shows is every one of the carriers who offers Medicare supplement plan in Connecticut offers a Plan A policy. All right? No matter who you get that Plan A policy from, it's exactly the same. If you're buying a Plan A policy, and we're going to show in the next page what goes through it. If you're buying a Plan A policy, no matter who you buy it from, you can only buy it from these organizations. If some other organization tries to sell you a Plan A policy, then I would call Western Connecticut Area on Aging immediately and say, hey, they're not on your list. And they're probably going to tell you those people are cheating you and that's why you want to work with one of us. These are all the organizations that offer Plan A policy. But that's not the important part that I wanted to convey. What I wanted to convey is what I've underlined in red here. You can have a Anthem Blue Cross Blue Shield Plan A policy, if that's what you want, for $1,210 a month. Such a deal, right? Except when you look down here and you see United Healthcare, AARP, they offer the exact same policy for $188 a month. Now, why would you be paying $1,210 a month when you can get the exact same policy for $188 a month? And also, no matter how sick you ever get, none of these companies cannot pay what they're committing to pay. There is a what I would call an Uber insurance agreement or reinsurance agreement among all of them, backed by the state. These are all reliable, good companies. And it is that analysis that I wanted to mention to you. That's the first cost savings that I wanted to mention, but there is more. Okay, the second.
Why would the state approve such a wide range of opinions?
Oh, okay, that's a good question. Did everyone hear that question? Why would the state approve such a wide range of premiums? And it's because I believe that I'm right, and Audrey can correct me if I'm wrong. Audrey's sort of my boss, if you will, although I just met her, in that I took a test. So I studied, I went to class last year on this, and then took a test that her administration, that her organization administers. And they said, you know, I meet the minimum criteria to be certified as a expert. And because I meet the minimum criteria, I'm still a rookie. I might not get it fully right, but I believe that the answer is experience-based. So that pool, the pool of people who are in that Anthem Blue Cross plan, they're sick. And because they're sick, the costs are higher. Uh-oh, here she comes. I'm trembling.
I have an opinion.
Okay.
I think there's only about like four or five plans that people sign up for here. I think the other one, I think it's marketing. They can say they sell in all 50 states, because I don't understand why people would pay, you know, the high rate. So I really think a lot of plans do a lot of marketing. And because I've never had anybody sign up for some of those. And just to clarify, those first A, B, and D plans, if I recall, those are, you can't sign up for those unless you're disabled. I think they're for the disabled. I think it's in the notes there.
Okay, so there are notes. I wasn't going to go into that level of detail. So you may well be right. I can't imagine many people sign up for those, but I do agree that the state has to approve those rates. They don't get to charge anything, and the way rates are approved is based on experience.
Right.
And experience is based on the case mix or the patient mix or the member mix underlying the experience.
Correct. Like that A plan is very expensive because that is for someone who is disabled, and people who are disabled have to pay a lot more because they cost a lot more. So that's why the disabled plans, some of them tend to be quite high.
Okay. So actually, I didn't know that the A plan was for, or A, B, and C was for disabled. I have my own view on what plan I would pick, and I'm going to tell you about that in just a moment. What I wanted to share with you is this benefits chart. So the second page, this was in the other side, but I photocopied it so that you could see them, put them across from one another and compare them. What it shows you is what each plan covers. And generally, the more check marks, the better. So when I look at this, G, that's a pretty good plan. In fact, Plan F used to be better than Plan G. Most people can't get into Plan F anymore, but I've looked at Plan F. Plan F rates, if you look at the difference in coverage, to me, I don't think anybody should be in Plan F. That was my initial thinking, because I think they would be financially better off in G. Plan N, pretty good plan as well. too. But there is some thinking and some discussion, and ultimately the decision is yours, not mine, not Karen Gaudian's, not Audrey's. It's your decision. We're just an independent perspective, an experienced perspective, who can help you think through some of the decisions. And what plan I would choose? Guess what? I enjoy, and I'm mentioning this because it's relevant to some of you for sure. I enjoy being married to a woman who receives as a benefit, she's a retired teacher from the Commonwealth of Massachusetts, free Medicare supplement plan and Medicare Part D plan. So I'm not going to take any of these, even though I live in Connecticut. No, I live in Connecticut. I have the Commonwealth of Massachusetts provides for her and me forever, from what I can see, free healthcare. And that healthcare, actually in our case, if we signed up for the Medicare Advantage plan, there we'd be restricted to a small group of hospitals in Massachusetts. We happen to go to Florida for at least part of the winter, and if we got sick there, we wouldn't be covered. But we would be covered through original Medicare and the Medicare supplement plan, which is national. So if you have a retirement benefit, if you're a government worker or even not a federal or state government worker, or even not, if you have a retirement benefit from IBM or Pepsi or wherever you might have worked, that benefit is probably very valuable. The insurance benefit that we have people refer to as it's just gold. It's just gold. Might change over time, but right now it's free. Okay, so how do you enjoy the benefits of open enrollment? Remember, it starts next week. So you can do it on your own. And that's great. You can also enjoy the benefits of asking people in the town. The town of Ridgefield, to the point that Clem mentioned earlier, is an unbelievable community. The town of Ridgefield has seen fit to ensure that every senior citizen in Ridgefield, or I should say anyone who's on Medicare, can enjoy, that means the disabled as well, can enjoy the benefit of having a free, private, and confidential discussion with individuals that they have, at their expense, had trained as volunteers to help you. You can take advantage of it or not. At a minimum, you're going to get peace of mind. Perhaps you're going to get a fatter wallet as well. Okay, the library is part of this. To Clem's point about the library and what a vital resource they are for this community, the library is part of this. They provide the space. They provide the assistance in scheduling. They aren't involved in the discussion, but they provide a convenient, well-known, recognized go-to location where you can come and you can enjoy peace of mind. Thank you, Lucy. Okay, and with that, I'm done. And I'd like to invite Audrey Cole from the Western Connecticut Area on Aging Agency, or Agency on Aging, WCAAA. Thank you.
So my name's Audrey, and I work with the Western Connecticut Area Agency on Aging, and my program is Senior Medicare Patrol. So I just want to preface my remarks, which I usually do, number one, with if you have a healthcare plan, a Medicare Advantage plan, and that is, you are a municipal employee or a retired teacher, or let's say you have a plan from Union Carbide. Those are all different from what we're talking about here. Do not give those up. Those are contracts negotiated by labor unions and so forth. And if you give those up, you may have a really difficult time of getting them back. And they offer many, many more benefits than if you were on just original traditional Medicare or the Part C Medicare Advantage plan. So I want to tell people in the audience that because some a retired teacher will come in and say, hey, I want to compare with Medicare. And I said, well, you can't. Well, I'm paying too much. And I said, well, you really aren't when you actually figure out the numbers. So that's really important. Before I start, I really want to give a plug to the Medicare Savings Program. I happen to love the state of Connecticut, and the Medicare Savings Program is a wonderful program for Connecticut seniors. First of all, Medicare is a federal program. The Medicare Savings Program is also a federal program, but it's administered by the state of Connecticut. So the state of Connecticut sets those numbers. And what's so important, like let's say for a single person, the base number, if you're a single person, is around $2,500 a month. Okay, it's about, okay, I can, yeah. Yeah, okay, so you can see the various levels, but there are two important things. And on our brochure, I get kind of annoyed because there's, Medicare is complicated. The counselors, like Joe went through the training and so forth, you learn a lot, but until you actually start using it, or the individual person, you start working with them, you need it. But for example, on these numbers, if you go over to New York State or Massachusetts, that 2569, it's around $1,500 to get into that program. So Connecticut knows this is an expensive state to live in. The second most important thing also is it doesn't look at your assets. It doesn't matter if you have 2 houses and 3 cars. And I say to people, even if this doesn't apply to you, because we do go to some wealthy towns, but there are people in all towns who are struggling. So even if it doesn't apply to you, if you know someone who's struggling with their bills, this is an incredible program. The first level there, the QMB, really acts as a supplement. It pays your Part B monthly premium and helps lower your drug costs. The higher levels of income levels will pay your, but the first level will do, the 20% that Medicare doesn't pay for, it pays for your deductibles and everything. On the higher levels, the main benefit is the Part B monthly premium. It will pay, that comes out of your Social Security usually. And 2, it will lower your drug costs. This is a fabulous program. And I can't tell you how many people will call me on an issue that I deal with, and I'll screen them for this, and I'll find out, they get food stamps, they go to a local dental clinic, and they are on the Medicare Savings Program, and they qualify. They're living on like $1,800 or $2,000 a month Social Security. The other thing that's not talked about in the brochure is this: if you have a part-time job and you're working, let's say you make $1,000 a month part-time, you can not be kicked out because it doesn't look at the full amount for wage income. This is like earned income, Social Security, pension, and so forth. But wage income is when you're working. And they only look at around 50%, a little less than 50% of that. So the state really encourages you, not to just get a benefit and twiddle your thumbs at home. You can go out and work and still not be bounced out of the program. So it's really an incredible program, and we encourage everybody to look into it to see if they qualify or they know someone who maybe will get help. All right, so I'll finish up on that. I'll tell you a little about my program. Let's see. Okay, Senior Medicare Patrol. We were about 25 years old, and we used to be jointly with the Choice Your Ship program. But I have this little diagram because everybody, the first question they ask, well, who are you? Where are you? What do you do? Well, right here, we are within the U.S. Department of Health and Human Services, as is Medicare. Our program, in effect, indirectly works for Medicare. We're in the same agency, but the ACLU is the administration that educates and trains us and teaches us. And as you can see, there's my program, SMP, and next to it is the Choice Your Ship program and also the MIPA program, which is similar. It's almost like Choices, except it looks at underserved communities, low income, rural. So this is our kind of our spreadsheet, and I want people to know that because the Western Connecticut Area Agency on Aging, we get about 86% of our funding from the federal government. I'm accountable to the federal government. I have a survey that I have to send in to see if you learn anything from our talks and so forth. And I want people to understand that because our agency wouldn't function without the federal grants and what we do, and it's really important. So I want briefly to talk because during open enrollment, this is what I do. I do this year round, but open enrollment, fraud in Medicare explodes, especially during these several open enrollment periods that happen. So I educate people. My main 3 words are protect, detect, and report. Protect by going out and educating people. Detecting, we give presentations on open enrollment, how to read your Medicare summary notices or your explanation of benefits if you're on a Medicare Advantage plan. We also give talks on the latest frauds. We will give talks on whichever people have a particular interest in. We will actually, focus on that as a particular topic. Now, how do I do this? Through outreach, like speaking with you, having conversations. I do one-on-one counseling just in the Choices and Ship program. And my reporting is to the federal government. I have a system called SIRS, just like Joe has in STARS, where we report all the work that we do, and it gets sent down to Washington. So if there's a particular fraud, and recently I've had quite a few of COVID-19 testing kit frauds, where people were getting a lot in the mail that they didn't order, and they were billing Medicare. People were taking photos of the kits, and I said, well, I really don't need the photo of the kit. I need to know the packaging, who mailed it to you, and I need to know if on your Medicare summary notice it was billed to Medicare. They were billing Medicare $96, which was, these are free tests. Some people were being billed and not getting the test. So I put this all in my computer system. All this information gets sent down to Washington. The Office of Inspector General looks at it, and if they can see that, and there's 50 of us throughout the country, senior Medicare patrol programs. So if they can see like one provider or one place is doing something, maybe a few months later, you'll hear a raid, the FBI and the Justice Department will arrest a bunch of people for this type of behavior. So the community, you are the eyes and ears of fraud and what's going on in the community. Once you're on Medicare, and that's between 18 and 64 if you're disabled, and over 65, those are all the people. There are tens of thousands of people who are disabled on Medicare. So if you suspect that something is fishy is going on, my division, Senior Medicare Patrol, is who you would call. Now, I also handle errors and abuse. Fraud is difficult to prove. You have to prove intent. So the question is, is this an error? So we find that out. Sometimes you can't really determine it until you've done some investigation on it. And then there's abuse. This isn't really physical abuse. It's like abusing the system. For example, on the Medicare Advantage plans, there's a lot of providers are listed there. Like you can get a walker and there's a company, and then you'll call them and it's not available. And they flat out told some people, well, guess what? We aren't reimbursed enough money. So we aren't going to provide it because, we lose $30 on every walker you provide. Another issue that I reported last week, if you had a Part D drug plan, for example, people right now are getting a lot of phone calls from either a Medigap supplemental or a Part D drug plan who you are enrolled in, and they want to sell you their Medicare Advantage plan, which is they're allowed to do because you are an existing client. But 3 people in the last 2 weeks felt pressured and they didn't want to switch. And these were agents who called them directly. We don't know where they were calling from even. So they've called our choices counselors. It takes a lot of time to switch somebody back to correct that. But I'm going to go through this a little bit more because these are just examples of some of the monies that were recovered and so forth. as I said, the COVID-19 testing scam is the most frequent. But because open enrollment is coming up, I have this handout, hard copy back there for anybody who wants to use it or access it. Please pick it up before you go. This is just an overall things to be alert for. Treat your Medicare number as a credit card. Do not give it out to anybody. And it's the same thing with your Social Security card too. This time of year, especially over the holidays when there's a 3-day banking period, there's an awful lot of fraud going on because they know that if you were to give out a number like that there's 3 days that will go by when many things are closed and you can't correct the error. So, and people are usually cooking dinner or doing something for their family and they're taken off guard. And I can't tell you how many people over the holidays, Thanksgiving dinner, Christmas, they call me and they say, I'm like an idiot. It was Medicare calling me and said, could you confirm your Medicare number? You know, we're sending out a new card. We want to make sure, you know, whatever. And I have to tell them, Medicare never, ever, ever will cold call you. Neither will Social Security, neither will the IRS. They will always send you a letter first. So please don't ever respond to a cold call. If you didn't initiate the phone call, you have to assume it's a fraudster calling you. You just have to nowadays. Medical identity theft. Medicare is losing about $60 billion, the estimate. That was from 2017. I'm sure it's much, much more right now. With the genetic testing scam, it's like if you fall for that scam where they say there's a free genetic test, they're charging Medicare anywhere from $7,000 to $15,000, which was more than the brace scam, where you didn't get a brace. You know, but they billed Medicare for it. So you have to be extremely careful on that. Imposter scams. This is where people are masquerading as a federal agency. Social Security, IRS, Medicare. And there are new rules going into effect that went into effect October 1st. I'm going to go over this because during this time of year, we're bombarded with ads and mailings. And I want to tell people that is not Medicare. They're saying to me, why is Medicare contacting me? There's only one document that you really should be concerned about right now, and that's the annual notice of change. That means if you stay in your, and it's a thick packet, it says if you stay in your plan and you do nothing, this is what the plan will be on January 1st. Everything else are Medicare Advantage plans trying to contact you, and you don't know what number you will be calling. Now, when I handle a complaint, people will call me and complain about something and they'll say Medicare repeatedly. And I will have to eventually tell them you are not on Medicare. When you turn 65 or you're disabled, you sign up for the red, white, and blue card and you get A and B. Once you have both, some people will just have A because they keep their employer's insurance for a while. But you have to have A and B. Once you have A and B, you have the option of signing up for a Medicare Advantage plan and opting out of Medicare. And why this is so important, I can't tell you how many people, when I have a case, and they're insistent, they're telling me they're on Medicare, and I have to tell them, no, you opted out. You're on a Medicare Advantage plan. And the way a complaint is handled is completely different. It's just like before you went on Medicare. You have to have a discussion with your private insurance plan. So right now, about 48% of Medicare has been privatized, meaning 48% of people on Medicare have signed up for the Medicare Advantage plans. And so you have to be, I tell people, you have to be your own best advocate because you are now working with a private insurance company. If you were to call up Medicare and complain, well, they said, well, we have no record of you. The only record we have is you signed up for an Anthem Blue Cross plan, or you have the United Healthcare plan, and they will direct you to call your plan to resolve the problem. There are people, and I can't recommend one plan, Advantage plan, over the other, just because you can't generalize on the needs of every individual person. So I'm very careful about that. However, I do have a lot of criticisms about them because more and more my complaints are now against the Medicare Advantage plans, mostly related to access, meaning once you're on it, can you find a provider? Or two, denial of care, especially when you go into a nursing home. That's one of the worst places because Medicare, traditional Medicare, pays more than an Advantage plan. And then they aren't allowed to disenroll you, but they will put you in this vicious cycle of having to appeal the denial like every 3 days. And when you're in a nursing home recovering from a fall or something, unless you have a real strong advocate to help you, that's not a very pleasant place to be in. So I consider those cases abuse, and I report to them when people have to fight to get their plan. 75% of these denials that Medicare would have paid if you're on original traditional Medicare are approved upon appeal. And then the question is, how many seniors actually appeal these? You know, because that's work. So I spend my time educating the people on the difference between these two plans, and I cannot recommend one over the other. Other than to say that I never ever once have gotten a complaint on a Medigap supplemental plan. And the reason that never happens is your dispute would be with Medicare. Does Medicare authorize the bill? Will they pay it? If the answer is yes, your Medigap supplemental picks up to 20%. There's no dispute. Medicare Advantage plans are managed plans. Most of them are profit-making companies, so they want to control costs. So I just tell people, be extremely careful. We recommend at the agency that you really pick your plan based primarily on the drugs and medications you take. You fill out the Part D. And I just want to brag that I did a couple of years back save someone $13,000 on switching a plan. The pharmaceutical companies know that people don't do the comparison. 71 to 80%, I think the Kaiser Family Foundation did a study of people do not compare during open enrollment. So, and the pharmaceutical companies will offer the same plan with a new name and it'll be cheaper. So unless you go do that cost comparison, you won't find it. So that's important. So I just want you to know what plan you're on. Know if you chose original traditional Medicare and what the benefit is to you and the difference if you feel a Medicare Advantage plan is more important. I had a woman call me up and she was furious because she loved her plan, but then she had very high, she went to physical therapist and she couldn't believe the copayment. I said, oh, well, what's your monthly premium? 0. I said, well, nothing's free. You know, they're making up for it on the other end. When I started, I was a choiceship counselor originally, and all the plans offered monthly premiums. They all right now, almost all of them have no monthly premium because they want you to sign up for them. But you have to look at the deductibles and the co-payments and whether all your drugs are on the formulary. And second, right now, there's a new Part D drug plan that it's 50 cents for that standalone drug plan a month. So that's $6 a year. Why wouldn't you sign up for it? Well, put all your drugs in there, see what the cost of those drugs are and the co-payments, because they may be making up for it on that 50-cent premium. I mean, this is work. Medicare is not easy. I apologize. So here, remember all these postcards everybody got in the mail, tons of them? Nobody can read the fine print, which says not affiliated with any government agency in the very bottom, teeny, teeny, tiny. We see they have to say that because Joe and I are affiliated with a government agency. We work indirectly for Medicare in the state. We're doing this. So they have to have this disclaimer. So you see these ads, these celebrity ads? I took this photo in a tire store, you know. See that Medicare logo up there? You see something Medicare helpline? None of this is Medicare. It's deceptive advertising. And I took out the 800 number because I was afraid if I kept it in my flyer, people might even call it, thinking it was legitimate. No, this is serious stuff. I mean, you might get somebody in the Philippines or Madagascar, and then then they will then route you to somewhere in the States, to an agent. That could be maybe in Arizona. There are a lot of independent brokers there who are really great and fabulous. Just make sure they're licensed in Connecticut, they're local, and you have recommendations from them, because we can't do it all on our own. So these are some of the new things as a result. As of October 1st this year, I went to a talk in Washington and they said that these ads were all going to go away, but I have a feeling that they're going to figure out a way around this. So I'm waiting to see what these ads are. They're not allowed to use the Medicare logo or Medicaid name in a misleading manner at all. And all these ads, if they do use ads, they have to be submitted to Medicare and pre-approved. So Medicare wants to see these. These are all new as of October 1st of this year. The other thing is they're supposed to have a disclaimer and saying you could call a choice-of-ship counselor, to get, they don't say unbiased, but we are unbiased, we don't get commissions, that you can call us, but it's supposed to be a 12-point font. So we'll see if we can actually read that. So this is a list of things. They have to strictly delineate between an educational event and a marketing event. And now, if they start talking about dental, hearing, and vision benefits, which are a great hook, that's now considered marketing. It used to be in an educational event, they could talk about that, and people were like, wow, Medicare doesn't offer that. But now they can't do that. And they now have to wait for 12 hours between an educational event and a marketing event. There's there's a list of 30 or 40 other things, but I just picked out the things that kind of highlight us. So we'll see if maybe this will cut down a lot of the misleading stuff and people know to whom they're actually talking. And the other thing, like you would see these ads, flex cards, and people would call up and say, I want that $8,000 flex card benefit. Well, they weren't offered in Connecticut. Those are national ads. Now, all these ads have to state what plan it is they're talking about and if they're offered in your area. And I think they're a region, and I think they're trying to do it by county, roughly, So we had one guy who called us, and he called up the 800 number, and he got a flex card, and he went to use it. It was defunct. It was inactive because it couldn't be used in Connecticut, number one. And number two, we were trying to figure out did he also sign up for a different Advantage plan? I mean, he didn't even know what he'd done by calling that number. So please don't respond to all these ads because they really are Medicare Advantage plans, which may not be suitable to your overall needs. So open enrollment. These are primary things that we want people to be worried about. Make sure that this really is the best plan for your needs. And a lot of spouses, they'll say, oh, I want what my neighbor has. It doesn't really work that way. You have to look at your overall health and your overall needs. If you have a problem and you're on Medicare and you think something funny is going on or fraud, or you feel that you were billed improperly, for example, the genetic, if they get your Medicare number, there are many ways they can sell that on the dark web for money. They will bill Medicare for something that you never ordered. They will send you a bill for a co-payment for something that you didn't want. And I can't tell you how many seniors pay those bills because they're more concerned about their credit rating than they are about whether or not it's a legitimate bill. And then they've also scammed Medicare. So just that one thing, they can milk it on many different levels of fraud. So be extremely careful. And we also have a volunteer program I have to talk about. As I am not Joe's boss, as I said, we are like joined at the hip, our two programs. And I went through the same training, and the exam is not a fun exam. It's a federal exam that you have to take to pass, and it's very involved. I didn't know half of what I learned when I took the original training, and we learn by doing. I learned something every week about Medicare. It's just amazing. It's very complicated, and every one of you interacts differently with it. So we all interact one way or another, but differently. So I hope I didn't take up too much time. I asked Joe if I could just have the opportunity to talk briefly about fraud and to know that there is a program once you're on Medicare and you start having problems and you suspect fraud or an error, or you feel that the plan you're on is not helping you, that you can call them. If you're on a Medicare Advantage plan, we tell people you first have to resolve the dispute with your plan. And after 2 or 3 times, and they keep giving you a hard time, then call us. And we will do sometimes 3-way calls. But unfortunately, it's very time consuming. Several of our counselors were on these calls with Advantage plans for 2 or 3 hours to get it resolved. And it's not fun. But they happen and people give up. We don't. So, thank you.
You have the next slide too.
Oh, I have another.
That's great.
Questions? Do you know where you the choices?
What,
Choices?
I'm a Choices, but Joe is also, he works here at Ridgefield.
I've never been talking with him for a second.
Yeah, and Karen also, I think, and there is a couple of other choices in Ridgefield.
She doesn't know.
Yes, she does. I work with her.
I do.
And she'll call me if she's got a problem, because she will, yeah. So yeah, no, and we do we tell people, we don't really like to answer main questions about your personal issues because we have to be really confidential. And I also tell people, don't put, your birth date, your home address, and your legal name. Just those 3 things fraudsters can do unbelievable things with that information. So be extremely careful. Don't put on Facebook, for example, all your medical problems, because scammers, criminals buy Facebook ads. So be careful.
There's a question here. Can you repeat that?
How does someone make an appointment with? Well, I have my brochures back there. You can take it, my name and number. But most of you, Ridgefield has an excellent staff of Choices counselors who can one-on-one in person.
Very lucky.
Right. We do open enrollment. We do on Zoom and over the phone. We do also do that too. But usually if you're in Ridgefield, I mean, we get very few calls from Ridgefield because your senior center does such a fabulous job.
So the answer, and also the direct answer, if you want to talk to me or one of the other certified counselors, my wife Lisa can take give you our phone number, but also the meetings are going to be coordinated through the library, so there should be some information going out within the next few days through the Ridgefield Press, etc. But I'm happy to give you my phone number or email address, and we can coordinate something. There's another question over here.
I did receive the information through the library on the number to call, and it suggested that you call early to make an appointment. And I did do that. I think I called on a Friday, so that was okay. There was no answer. We played a little telephone tag once or twice, and a message that I got was, "Are you on Medicare?" And I said, yes, when I called back, but I have not received an appointment, and that's been about 10
Was
years.
that our agency or the Ridgefield?
It was a woman's name, and it was for Ridgefield.
Okay, so you call.
Yes.
But I know that we had just entered 96 sessions yesterday. So,
Well, that's what I'm saying, possibly she will be getting to me, but
So
I'm
leave
not
your
sure.
name and number, and someone will call you back.
Right.
Yeah.
Thank you.
We can give them the number of.
Right. So this is also a brand new program at the library. They offered to help us with that. We asked them. And so it could be that there are some.
Yeah, I'm sure that.
So I know there are at least 3 people.
Keep in mind, these appointments are usually for about an hour.
Yeah.
Yeah.
Okay. Another question?
One comment.
Yeah.
Audrey, thank you so much. It was
Yeah.
so informative. As much
Very
as I
helpful.
want to know, I
Very
didn't know.
We're gonna go.
You were very clear, and thank you very much.
I have a survey I'm going to hand out briefly, and I'm going to give you I didn't thought, we have a newsletter from us, it's coming to here. We're the only area, and we do that. Oh, it's just a hard copy. So if anybody wants to find out, it's chocolate block full of information.
Come in the paper, does it come in the
Yeah,
paper?
only. Yeah. Oh, you can get it online too. Like, oh.
I want to echo what you said. I think Audrey was outstanding, just
Yes.
way over delivered. There's another question?
Thank you.
Another question? Okay, so I'm going to give the both in case anyone online wants it. So it's my first name, last name at gmail.com. So JOETERNULLO at gmail.com. And it's a Boston area code 617-688-7031. I thought about it after. I should have had it up on the screen. Any other questions? All right, so now we're back to Clem and sounding board.
Okay. Okay, thank you. Okay, so I would like to thank Audrey and Joe because they did such a magnificent job and really enlightened, I think, a lot of people. But right now, we would like to know, what is the town doing right? And what can we do to fix something that's bothering you? What strengths can we build upon? And what are some of the weaknesses that we need to shore up? An example from the last meeting was that there was a woman here who was having problems meeting her bills because they were multiplying so quickly. And she and her husband were ill, and they were taking a lot of different medications, spending a lot of time and money. I'm sorry, excuse me. Spending a lot of time and money trying to stay here without selling the home that they loved and moving away. That was a very important thing because the Department of Social Services can help people who are having problems and have a lower income. If they had known that, they could have called social services and gotten information from them that would help them stay in Ridgefield. I'm sorry, if you could just, we're listening to questions now, so if you could just, if you have a question, just raise your hand. So what can we do to help people in Ridgefield? What are your gripes? What is bothering you? What can we do to bring these issues to the selectmen so that we can solve problems one at a time? Not very quickly, but one at a time. So do you have any thoughts on that?
Can I also just say,
Go ahead.
this has to be a lightning round because they have other people coming in here.
Okay.
We used up all of our time.
Okay, so we've used up all of our time. Someone else is coming in. But if you do have a question, could you please address us? Anybody have any questions? Any gripes, any groans?
Why are we building a boardwalk at the swamp?
Well, I think that they,
I haven't seen it.
No
it's,
cost. There's no cost to the town.
no cost to
Oh,
the
that
town.
right?
It's from the state,
Oh,
state and government. State and government, yeah. And we don't have sidewalks. I walk wherever I go. I do not have a car. So we don't have sidewalks. Next one.
walk to the dump? Yeah, right.
Yes, I do walk to the
No,
dump.
no. It does go someplace. Stop finish yet.
Okay, next
so-
question.
We have, they have other people coming in here. We used up all of our time.
Okay,
So we're gonna end this now. Let's talk for a few minutes in the back.
okay,
Okay.
so next meeting is November 14th. And at that meeting, Teresa Santoro from RVNA will be coming to discuss health and wellness with us. So thank you all for really coming, and I hope I was okay. It's my first time. Thank you.
Thank you, everybody.
Thank you. Thank you for coming. Thank you.